Coming up next on Arizona Horizon, we'll take a close look at the health care plan released today by Senate Republicans. Also tonight, a law that opened up college sports programs to women is turning 45 years old. And we'll hear about the first woman to earn a football scholarship at a Division II or higher school. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. Legendary ASU football coach Frank Kush passed away this morning at the age of 88. Kush had been in declining health over the past 2 years. Frank Kush was more than a football coach. He helped with ASU's transition from a college to a university and was instrumental in putting Arizona sports and Arizona itself on the map. Kush coached ASU's football team from 1958 to 1979, a run that included a school record 176 games. In 1975, his team finished with a perfect record, which included a win over Nebraska in the Fiesta Bowl and a #2 finish in the college football rankings.
One was 1975, the Nebraska game. Dennis Sproul, our quarterback, got hurt. We sent Fred Mortensen in, and Fred did a commendable job. My son Dan kicked 3 field goals. He finally kicked a winning field goal, and that had to be one of the greatest football teams we've ever had.
Danny White, who was quarterback under Kush in the early 70s, reacted to his death by saying, quote, "If you know Frank Kush, you know the kind of man he was. His recent life has not been a life you would have wished on anyone. That mortal body that was holding him back and giving him so much pain is gone. He's a happy man once again." ASU Vice President for University Athletics Ray Anderson also reacted to Kush's death. He said Frank Kush is Sun Devil football. Frank was the architect of Sun Devil football and is revered by all Sun Devils everywhere. He's a college football Hall of Famer. He's in our Hall of Distinction, and the field at Sun Devil Stadium is named after him. Today, he and his family are in our hearts. Kush's career famously ended in controversy when a player said Kush punched him during a 1978 game. After leaving ASU, Kush went on to coach in the NFL, the Canadian Football League, and the short-lived USFL. He came back to ASU in 2000 as a special assistant to the ASU athletic director and remained a part of the ASU athletic department for the rest of his life. Again, ASU football coach Frank Kush passed away today at the age of 88. Senate Republicans today released their version of health care legislation designed to replace and repeal the Affordable Care Act, or Obamacare. Here now to break down the Senate plan is Dr. Daniel Dirksen, a health policy expert with the University of Arizona. Good to see you. Thanks for joining us.
Good
Thanks
evening.
for being here. This Senate bill is how similar to the House bill?
Well, it's very similar. In some ways, it's worse. The cuts to Medicaid are worse than the House version. It was estimated by the Congressional Budget Office that the House version would remove about $834 billion over the next 10 years from Medicaid programs. In Arizona, that means a cut of $2 billion per year in Medicaid funding, and 400,000 would lose coverage in Arizona alone. In the country, it's estimated that those cuts would force 14 million off of Medicaid and 23 million that would become uninsured. In Arizona, the total uninsured would increase by over 500,000 to return us to the days of 1.2 million uninsured in Arizona. So these are very draconian cuts in both the funding over the next 10 years, but also many Arizonans lose coverage.
And again, as far as Medicaid is concerned, because that is the biggie as far as Arizona is concerned. Now, states that expanded, like Arizona, get to keep funding through 2023, even though that funding, the cuts started about, what, 2021, somewhere around there?
That's correct. So this version, the Senate version that came out, the Better Care Reconciliation Act is what they're calling it, delays it for a year, and the way they've described it in the Senate, that this would be a softer landing for states. But from my view, it's a crash landing. This would seriously damage the state's Medicaid infrastructure. It's very hard for any state to absorb the kind of cuts we're talking about over the next 10 years of Medicaid funding.
I know it also caps future federal funding per enrollee. However, the states do have options for these lump sum block grants. What are those, and are those enough to cover what will need to be covered?
Well, the Social Security Act created Medicaid as an amendment back in 1965. And from that time, over 50 years, 5 decades, the federal responsibility has been statutorily limited to 50% of a state's Medicaid costs. In other words, the federal government has to pay at least 50%. In Arizona, it's 70% is the federal share. So this bill repeals not Obamacare, but the Social Security Act that requires federal funding. And it converts it to this per person amount based on a previous year's experience. So no longer can a state count on from year to year this being part of entitlement funding. Instead, it'll be shifted to discretionary funding and the year-to-year battles in appropriations rather than being guaranteed a certain amount based on utilization.
But the block grants themselves, are they year-to-year, the block grants?
They would be a year-to-year type of thing. This is the big shift that people aren't realizing, that this shifts it from an entitlement funding to discretionary funding. And so these are the cuts we're talking about just in Medicaid of over $800 billion over the next 10 years. But in addition to that, every year they could come back and cut more because now it's the yearly appropriations battle in the discretionary side of the federal funding. That's the real concern.
If it starts, the cuts start in 2021, and ending up with completely adios in 2023, how do hospitals respond?
Well, we've been through this in Arizona during the Great Recession. We were one of the, unfortunately, the bottom 5 states as far as job loss. We lost more jobs than all but 4 other states. In the last 5 years, we've been one of the top 5 in job growth. And the biggest growth has been in the health sector. This would reverse us back to 2008 to 2009, where almost every hospital was at the brink of fiscal extinction due to the loss and the increase in uninsured and uncompensated care.
When you bring up those concerns to those who say that this is a better idea than the Affordable Care Act, Obamacare, what are the arguments on the other side?
I don't see how this is a better deal, certainly not for the 75 million Americans who are currently on Medicaid or the Children's Health Insurance Plan. We have almost 2 million of our population, which is a total of 7 million in Arizona, that are on Medicaid or CHIP. This is not a better deal. This is not more choices, and it'll make it almost impossible for the state to balance its benefits that it offers through our Access program. What people don't realize in the Medicaid program in our state and every other state is that 2/3 of the expenses relate to 2 eligibility categories of Medicaid. And those 2 eligibility categories that are very expensive are the frail elderly and the blind and disabled. How can a state make up $2 billion a year difference in its budget to take care of a group that's very expensive to take care of? What are you going to do if you have a disabled child and suddenly your funding goes away, or you're on a waiting list and cannot get help with the cost of care for your disabled child? This is a real issue for us that we're facing.
Another issue is regarding the Affordable Care Act said you couldn't charge more than 3 times more for older folks than you did for younger folks. This plan says 5 times or maybe more could be charged to older folks. And I know Kaiser came out saying that a 60-year-old in Phoenix would pay $9,000 more per year if they made $40-some-odd thousand. Bottom line is, older folks are going to be paying more under this plan.
Yeah, some people are calling this the age tax, and I think that's what's getting a lot of pushback right now, especially in states like ours. We're in the top 5 states as far as growth of our population in low-income elderly. We're one of the top 5 states. The 5 states that are in that category are going to be unduly punished by these draconian changes. So we have that, plus we've been very cost efficient. We have the 8th lowest per capita expenditure for Medicaid in the country. And because we've been so efficient, when you go to a block grant based on previous year's history, we've already been one of the most cost-efficient states. And we're going to be pegged to that, while the states that have been less cost-efficient are going to be rewarded for that inefficiency. That's a lot of the policy discussion going on right now.
A couple other aspects: dependent coverage until the age of 26, they can still, that doesn't change now. Up to 26, you can stay on mom and dad's coverage.
That's a very popular provision, and from the get-go, that's been one of the ones that has been protected.
Now, the taxes to help pay for coverage, I mean, whether it's prescription drugs, medical devices, indoor tanning, whatever it is that was taxed under, I mean, they're all gone.
Yeah, so the revenue side goes away, so you have less income coming in, and those were some of the pay-fors of how you expand coverage to such a large number. We're at the lowest rate historically of uninsured in the country, and the way you pay for some of those things is through some of these revenue side of things, the tax parts. All those get removed, so there'll be less revenue coming in, And then, in addition to that, almost $1 trillion over the next 10 years in cuts to Medicaid.
Bottom line, okay, last question here. How would this change the nature of health care? Because right now Republicans are saying Obamacare is failing and failing fast. Something's got to be done. This is what they're doing. What's it going to mean?
Well, this is really repeal of the Social Security Act that created Medicaid. That's the big issue here. And the problem with that is that what you do is you go backwards. We'll go back to the days of 50 million uninsured in this country. We'll go back to the days in Arizona of 1.2 million uninsured. And to me, as a family physician, you do not save money by throwing people off of coverage. All you're doing is the hidden tax of shifting those costs to physicians, to nurses, to others who are taking care of them, the hospitals and the clinics. You're just shifting that in the form of uncompensated and charity care.
All right. Thank you so much for joining. It's good to see you again.
Thank you.
This is Arizona Horizon. Up next, we talk about a law that opened up college sports to women.
Growing up, my family had no real idea of where we came from. It's kind of like being in a fog because you feel like a piece of you is missing. What is the rest of my story? I saw African American Lives on PBS. I love the series, and there was a DNA kit that you could order to find out your African ancestry. And so I really got excited. My DNA results said that I was from Ghana. Wow. It just really opened me up to a whole new world, so I went ahead and started doing things. Now my mission is to write stories to have something to pass down to the next generation. It's important to know where you're from and to tell your children, teach them that. PBS helped me to go on a journey to discover who I was, and that journey will never end.
Tomorrow marks the 45th anniversary of Title IX, which was signed into law by President Nixon. Title IX prohibits educational facilities that receive federal funds from banning participation in sports programs and other educational activities, a move that's made a significant impact on women's sports. Here to talk about Title IX is Dina Garner-Smith, the Senior Associate Athletic Director for ASU, and Bianca Arellano, ASU volleyball and beach volleyball alumnus. Good to have you both here. Thanks for joining us.
Thank you.
Give me a better, what is Title IX?
Title IX is actually an educational law allowing for women to participate in education, and because in the United States, educational opportunities and to participate in sport are co-curricular activities, Title IX affords women to be able to do that.
And in researching this, the education aspect was really the first that went through, and then athletics kind of followed, correct? Education was Nixon, I think, and athletics was actually Ford by then, correct?
Correct.
How did it, from what you've seen, how has it changed women's sports, participation especially? It's
interesting that you asked that question, and we live in Arizona.
Yes.
Because at ASU, Arizona State had done so many things for women almost 20 to 21 years prior to the Title IX Act being in place in 1972. So when it was enacted, it just allowed for more opportunity for women, so they didn't have to work the sport and also play the sport. So it allowed for them to fully participate in a sport.
Interesting. Was that the matter? That would usually happen? You had to work it to play it?
Yes.
Isn't that something?
Mm-hmm. Or volunteer your time.
Yeah, yeah. Mm-hmm. Are you familiar? How familiar are you with Title IX?
Well, just recently we had a celebration and a party to kind of make the public more familiar, and especially the student athletes more familiar with this educational law. But from a sports perspective, we are blessed to have such an impact on us.
When you hear about how the landscape was before Title IX, before women were able to participate in so many different things at high schools and universities, kind of hard to believe?
It is hard to believe.
Yeah.
Yeah.
How were you encouraged when you were younger? I mean, volleyball, big-time volleyball player here. How were you encouraged? Did anyone ever say no?
Well, luckily I grew up in a family where my parents kind of instilled academic excellence. So I was sent to an all-girls Catholic school just down the street where they kind of force academic excellence on you, and that just so happens to correlate with athletic dominance. And so at Xavier, we were blessed to just have both experiences in academics and athletics.
And it never occurred to you that this is something I shouldn't be doing or something that's odd for me to do?
Absolutely, it just came inherent to me. In
it's interesting to hear that, isn't it?
Yes,
I mean, that wasn't always the case.
No, it was not. It was definitely not. And talking with so many of our legendary coaches, from Sheila McInerney to Charlie Turner Thorne, who have been trailblazers here in Arizona and in particular at Arizona State, talk about just the evolution when they participated in sport as a student athlete, and then to be given the opportunity at 23 years of age and 24 years of age as a head coach is amazing.
Yeah, and we're watching a lot of women athletics here. It's, again, I think for folks of a certain age, the idea that women couldn't compete in all of the things that they may want to compete in, or as you said, they had to volunteer or work, it just sounds odd.
Yeah.
Yeah.
Yes.
But this, and again, athletics for women, how important is that as far as lifelong learning and achievement?
Absolutely, extremely important for employers. You know, when you look at, I know there's a statistic that Dr. Victoria Jackson communicates about, and also Dr. Nicole Lavoie at the University of Minnesota, that a lot of your top women that are in business in Fortune 500 companies, many of them were athletes in college.
Yeah.
And so it promotes leadership skills, confidence, the ability to work through adversity with a team that there may be some people on your team that you don't really have much of an affinity with outside of your sport, but through the sport you learn to work together to achieve a common goal. And it also promotes character and integrity, because you can win, but if you don't have all those aspects along with having that integrity and character, you may only win like a few times.
Yeah.
But just when you have everything that works in concert with each other and have a championship culture, you can do some phenomenal things.
Yeah, it really, I mean, volleyball, very much a team sport. Even beach volleyball, you got to have a few people, another person at least around there with you. I mean, that team thing comes through, doesn't it?
Exactly. There's so many influences that sports has on you in terms of your character or your leadership building, but it just so happens it coincides with education, so we're thankful to have had this amendment, this educational law.
Does it feel now like women's sports are on an equal footing with men's sports? Does it feel about equal to you?
I think so. I mean, I know there's the certain Title IX myths and some discrepancies out there, but it's definitely pushing forwards towards gender equity and equal representation in females coaches and administrations, and especially student athletes.
Yeah. So it seems like it's pretty much there.
Yeah, I would say.
Feel like it to you as well?
Well, I would say that the one thing that also was very interesting after Title IX was passed, the NCAA created a designation, a governance designation, which is also part of my role at Arizona State, called the Senior Woman Administrator. So I'm the person that is in the athletics department that works in concert with the athletics director, so Ray Anderson,
yes,
and our team, and also the faculty athletic representative, to make sure that from a gender equity perspective, that all of our teams are appropriately sourced and resourced. And so I work with the business office, work with our HR department, and work with all of our sport administrators to make sure rosters are managed appropriately and we have equity.
All right, so you're the one that watches out for this stuff, aren't you?
Yes.
All right. Well, good to have you both here, and thank you so much for joining us.
Thank you.
We appreciate it.
Thank you.
We want to hear from you. Submit your questions, comments, and concerns via email at arizonahorizon@asu.edu.
Teenager is making history for receiving an NCAA football scholarship to play at a Division II university in Colorado. That's because the kicker from Basha High School is believed to be the first woman to receive such an award. Rocky Mountain PBS correspondent Lori Gigliha reports at this moment in time is inspiring many to follow their dreams.
At first glance, this Arizona high school senior seems like a typical teenager.
Does my nose look big?
Posing and primping, trying to capture a perfect picture to post online.
This is probably the ugliest thing on my head.
But for Becca Longo, these final fleeting moments of her high school career are far from typical. They're historic.
Now I'm on Good Morning America, ESPN, CNN, all of these huge like organizations are doing interviews on me. And so it's just crazy. It's overwhelming. My phone is constantly going off.
Longo is attracting international attention because she is believed to be the first female to receive an NCAA football scholarship and sign a national letter of intent. She'll be a kicker at Adams State University in Alamosa, Colorado this fall.
I feel like it means that I'm doing something. To be getting this kind of attention, I feel like I'm like having like my story heard, and I'm letting people know that like you can do anything that you put your mind to.
Great stories begin here, according to the campus slogan at Adams State University. And for head football coach Tim Rosenbaugh,
I mean, obviously it fits this. It does fit this.
One of those stories is Becca Longo's and how she made it on his team.
Is it really a great story yet? Let's make it. We're going to have to work our tails off, me, her, the rest of our team, to really make it a great story.
I'm still like pinching myself because of everything going on. It just doesn't feel real. I'm always nervous the very first kick of every game.
Longo first set foot on the field competitively as a high school sophomore.
And then 2 steps over.
Inspired by a girl on her older brother's football team.
So I spent all of my like childhood like watching her playing on the field, and so that was pretty cool. That's when I realized that girls could play football.
A multi-sport athlete and former soccer standout, Longo knew she had a leg up when it came to kicking.
Why was it important for you to try out for football? I mean, why not just continue on with soccer and do the girls' sports?
It was just different. I mean, I've done everything else. I wanted to be different.
In order to be different, Longo had to be good enough to secure a spot on the varsity team. That meant getting a doctor's clearance to play after straining her back and convincing the boys' football coach, Gerald Todd, to give her a chance.
Your honest first impression, did you really think that she was going to end up being your kicker?
Honestly, I imagine no, but I wanted to see if she could kick. She came out and she kicked, and it was impressive. She was had a strong leg, was hitting everything from about 20, 25 yards in. She really kind of earned her spot that spring.
It was countless hours of just training and kicking and more speed training, and then just getting my hips ready. It was just, I spent a lot of time.
I am so proud of that little girl.
Yeah.
She's amazing. Sorry.
Yeah.
She's amazing.
Andrea Longo has always known her daughter would achieve great things.
She always wanted to be famous.
Even from the moment Becca was born, she was defying the odds.
I'm sorry. We didn't think we could have children.
The Longos suffered several miscarriages after their son was born. And more than a decade later, Becca became their miracle.
She's our world. She's our world.
Good job, Becca, good job!
During his daughter's early games,
She is right here.
Okay.
And this is her holder.
stress would overcome Bob Longo in the stands.
I go, oh, just please make it. I was sitting there just shaking. I mean, I couldn't even really hold the camera to go ahead and, to videotape her because I was just so nervous.
But Becca's kicks would prove to be so much more important than the 36 points she scored during her senior year. She was blazing a path that would eventually land her a place in sports history.
I know that for a girl doing this in front of all these people, all the coaches, they're all saying, oh, she can't do this, she's a girl in this, and she went out there and she proved them all wrong.
I'm proud of her. She has accomplished everything, except for pre-calc. Everything she has attempted to do, she has succeeded at. She's an amazing girl.
This is my favorite spot to kick from.
Why?
Because my parents usually sit right there.
How do you make sure you're accurate?
You don't aim, that's the trick. You keep your head down and then you just follow through and then it just naturally will go.
In a way, her advice for kicking a field goal, to follow through, is also what helped her reach her personal goal, to play college football.
I have a ton of videos on here.
She connected with Coach Rosenbaugh by sending him clips of her kicks on social media.
She put herself out there. You know, when somebody does that, to me, that kind of says something about them as a person. If they're determined to do something and be maybe in a not so popular situation, then you have to really want to do it, and that's what caught my eye.
Her persistence paid off with the former NFL quarterback and the father of 2 young girls.
It's pretty awesome that they can see this happen.
He's seen other women kick at other colleges, but never realized he would be making history when he offered Longo a scholarship.
And I think it's great for young women all over the place. I mean, I don't know why more people don't attempt to do this.
How much pressure do you think she's feeling?
From a perspective of a person that played quarterback, a lot of the pressure came from inside. I think she has that as well. She wears that a little bit inside, but I think she's pretty rock solid on the outside.
Well, I mean, I know I can do on the field, and if there is any pressure, I love it. I love pressure, I thrive in it. I'm that person that if we're on 4th down and coach is thinking about going for it, I'm jumping on the sidelines hoping he's putting me in.
As Longo looks forward to a chance to kick in a college game,
ready, get ready, get ready.
She's helping little girls around the country look forward to new possibilities in their futures too.
Go, 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 go! Like all these little girls out here, everybody's saying that I'm inspiring them, but I feel like they're inspiring me to become a better person because I know that they're all watching me. Hey, way to run through it, good job.
Whether or not Longo makes any plays in a college game, she knows the biggest impact she will make may not be on the field.
There you go, nice, go ahead. I'm just trying to get people to do what they love. Like I'm trying to set an example, be a role model in a sense for a bunch of people out there thinking that they can't do something and showing them that anything is possible. Run through, keep going, keep going.
And as we mentioned at the top of the show, ASU legendary football coach Frank Kush passed away this morning at the age of 88.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.